Hello.
Good evening, everybody. Oh,
Hello. So we're both on. We're live now. Thank you for joining us for our webinar series. The lovely Cheryl is back. She did our first one, and we're on our fourth tonight. We have 4 more to go. We thank you for joining us. I'm Ellie Borden, the clinical director and founder of the Life Clinic. And as I mentioned, the amazing Cheryl is also on the screen, and she's going to be presenting about mood and pain management. She has a fantastic presentation prepared, so I can't wait for it. Please remember that you can enter your questions in the chat room, and at the end, I'm going to be presenting the questions to her. I'm also going to be there to support you throughout in the chat room, and remember, it's confidential. So feel free to share. Your name will not be shown. You just will see my responses to everyone, and I'll make sure I keep that confidential. So Cheryl, with no further ado, I'll take myself off the screen and take it away.
thanks so much, Ellie. Welcome everybody back to this is our 8-week webinar series where we're really passionate at the Life Clinic about providing support, accessible service from evidence-based mental health professionals and practices. We include in our services, if you're not aware already, psychological therapy, coaching, and assessment. And so it's not just these types of things that we do. The team is made up of a wide variety of experts in their field. And for me personally, I really benefit from that. We learn a lot from one another, getting lots of diverse pieces of information. I know last week my colleague presented on attachment and relationships. And so these webinars, as we go through, are recorded and will be sent out to you so you have access to them afterwards in addition to the handouts and things like that. So as Ellie mentioned, this is the 4th in the 8-week series. And so next week we have, I'm just going to take a peek here, we've got relationships, meditation for stress the following week, support for caregivers of people with autism spectrum disorder, and anxiety reduction techniques. So definitely check those out. They are at the same time on Wednesday evenings. Okay, and as Ellie mentioned, there are questions that you can ask during the chat. It is private and confidential, so she will read them, and at the end she'll come back on and read out the questions to me, and I'll do my best to answer them. And if I can't, maybe somebody else can help. Okay, so we're going to get started. The topic tonight, as Ellie mentioned, is mood and pain management. And I think that probably all of us can imagine the connection between that, right? Those two things. So when we look at, oops, I think I just stopped sharing my screen. If you guys saw my first presentation, you know I'm not a multitasker, so let's just bear with me while I do this. Up and running, here we go. So the connection between mood and pain management, when we're dealing with pain, whether it be a quick onset pain or long-lasting prolonged pain, it does affect our mood either momentarily or in a chronic level, right? So the relationship is a really important one. So tonight we're going to be talking about pain itself, understanding the mind-body connection, the perception of pain, and how we might have beliefs around it, but we're also going to be talking about its influence on our mood and being mindful of some flags that we might want to be paying attention to with regard to our mental health. If we are experiencing chronic pain, it's possible we may also be experiencing symptoms of depression or anxiety that go along with that. So we're going to talk about that this evening. Okay. As a result of this pandemic, we have had to make major adjustments to our usual access to physical activities. Many of us went to, a physio clinic or saw a chiropractor in their office or a massage therapist, and all of these professionals have needed to close their doors to offering hands-on or face-to-face service, right? And so we're all kind of struggling with how do we still manage to benefit from the knowledge that's there, knowing also that the professionals themselves are very much wanting to be able to help their clients, right? So quite often what we'll find is that there are alternatives to what we might have been doing in the past, right? And we might have gone into the physio office, and now we might look at making a call and seeing what they might offer either online or over the phone or perhaps even on print handouts, right? With regard to social interaction, we've also had to make major changes, and I'm sure a lot of people have gotten really creative, right? We've had, I've seen people in my neighborhood doing social distance walking, where they're staying there 2 meters apart, wearing a mask. And so figuring out ways to adapt, right? I mean, and that is sort of, I think, humans' greatest strength is our resilience, our ability to adapt, to change. It's painful. We talked about that in the very first of this series on coping with change and acknowledging complex emotions that surround any changes that we might experience. This was massive, right? And so as the weeks have gone on, I think we've all noticed sort of trends, right, in our own well-being. There may have been weeks or days or moments where we felt well or more well, and others where we felt less well or less able to cope or less able to adapt. These fluctuations are very normal. But when we're dealing with chronic pain, we have to be able to tune into our bodies in a different way, right? And assess what we need on a given moment or a given day, and find new ways of connecting to the resources that have been very supportive to us up until this point with changes to businesses. Okay. So one of the questions that I want to ask is, what have you learned so far? For many of you who had been previously accessing services face-to-face, what are the things that you have learned? And so by going through the recommendations that have been made to you by previous professionals, you might have a psychotherapist, you might have a physiotherapist, what were the things that they had recommended to you? And if you don't remember, reach out to your professional and say, listen, I'm wanting to be able to carry forward some of the work that we were doing together. Is it possible you could do up a package for me to help me have kind of at-home practice, right? That is safe for me to do, but that it is also effective at maintaining perhaps the gains that you had made while you were in face-to-face therapy. And you might be surprised at how many things you're able to carry forward on your own, right? And how willing. You have to look at the types of people that choose these professions, right? We are not working in an auto body shop. We are, working with human beings, and we've chosen that because we care deeply. And so for us, we're very willing to want to help in any way that we can, right? So don't be shy to reach out. So I've put down a little kind of table here, right, in terms of, if I'd previously been recommended to access psychotherapy, I know with the Life Clinic, we moved immediately with the recommendation from the ministry. We moved very quickly to online secure video because we didn't want there to be a break in service for our clients. And so if you're not finding that connection has been made elsewhere in your life, inquire about what options might be available. Myself, I have clients that I see online by video, but there are also some clients who prefer telephone. And so if you're more comfortable with that, be vocal. This is where you advocate for the things that you need, right? Physiotherapy and chiropractor, massage. This might be, like I said, calling the office, asking. Now we're starting to see things starting to open up, asking what their plan is for reopening, how they might recommend that you proceed in this time if you haven't done so already. Lots of us have doctor's appointments that we might need to keep up on, checking in with your doctor. Many of them have switched to telehealth options. And will still continue to see patients if it's needed for a face-to-face assessment. So definitely check in if your family doctor or practitioner has not reached out to you. Goodness knows we've heard from every company we've ever purchased anything from about how they've been handling COVID. So I would hope that your primary care physician has reached out to you. But if they haven't, take it upon yourself. Don't be passive about your own healthcare needs, right? The help is there. People have moved quickly. They have adapted to being able to provide some type of service and assistance to you. Okay. When we look at our own attitudes and beliefs about pain, we might be surprised, right? I think we think of pain as something that, as an infant, you can see a pain reflex immediately. We think of it as a reflex, right? Response. So you feel pain and you react a certain way about it. We think about it more of a physiological response. What happens though, if you think about it, from our very earliest memories of pain, we start to accumulate a database of experiences, thoughts, beliefs, attitudes about pain. And in some cases, it can be very emotionally charged, right? Pain can be a signal of danger. It's a very important signal, certainly from a physiological and biological perspective. But what are the other types of things that are happening that contribute to our perception of the pain? And I don't just mean perception as a feeling, I mean perception as an awareness, right? An overall awareness. The handout that I'm going to pull your attention to at this moment is there's the one called 15 Common Cognitive Distortions. You don't need to open it up and read through it right now, but why I've placed it here is that we all have cognitive distortions. Every single one of us. We are more likely to have a few that are kind of go-tos for us. And those go-tos are often connected to times of stress or duress, right? When we're not functioning at our best, when we're perhaps tired, when we're perhaps overwhelmed, when we're experiencing pain, when we're otherwise just sort of working at a lower sort of level, right, than our best. And so these cognitive distortions, it's really important to be aware of which ones are your pitfalls. So this is just a handout that I got online, and you can certainly Google any number of lists. You'll see 7 cognitive distortions. I like this handout because it gives examples of each of them. Becoming aware of what our own beliefs are and our tendencies under stress is a really important thing, because awareness and change can only happen once we're aware, right? So, for example, one of the common cognitive distortions about pain might be a faulty belief that pain means that damage is being done, right? I might have the belief that if I'm feeling pain, something is gravely wrong, right? And that, again, that attitude or that belief can be something that initiated way from early in my childhood. Say I had an accident or a bad fall on a bicycle, and my mom overreacted and said, "Oh my gosh, you're gonna die." It could be any of these things that contribute to our beliefs. They're very complex, right? We look at our history, how much pain we may have experienced in our lifetimes, what our general pain tolerance is, but also what the attitudes and beliefs were of our primary caregivers, the people who influenced us the most in our lives, right? So take a look through in your, after the workshop has finished, take a look at the cognitive distortions. This is useful in just everyday life. We'll find cognitive distortions turn up in interpersonal relationships, in conflict. We'll have our kind of tendencies, right? I maybe always jump to conclusions, or I, have engaged in what we call catastrophic thinking, right? Which is, if something happens, I immediately jump to the worst case scenario. Now, I might not do that on a daily basis, but if I'm under duress or under stress, I might have a tendency to catastrophize, right? Okay. So there are also, if you're working with a therapist, a psychotherapist, or a social worker, they will be able to do some assessments with you to gauge your pain attitudes and beliefs. There's one called the Survey of Pain Attitudes, and I believe it has 21 items, but it's a questionnaire. This is really useful because sometimes we're not aware of what our own beliefs are, right? So have someone walk through that process with you of learning about your attitudes about pain and where maybe there might be some room for adjustment, right? We'll talk a little bit more about that in a moment, about the connection between our thoughts, our feelings, our behaviors, and the environment and physical sensations. When we look at pain, we talk about it in 2 categories, primarily. There's acute and chronic. And acute pain is necessary for survival. It would be the kind of pain that you experience if you were to touch a hot stove or to step on a sharp object. That pain that you feel is communicating necessary and vital information, oftentimes automatically before your brain even has a chance to process what has happened. And so for this, it's using information that's kind of gathered in from our nervous system, right? Meaning that I have sensed this, that's happened, but it's also tracking it through our brains and going, where else have I experienced this, to try to make sense of what has happened, right? I don't know if you've ever had the thing happen where you've, banged your finger, or you've caught somehow and you feel pain, or you'll see it in movies even where somebody gets shot, but they're in such an adrenaline mode that they say that they just felt hot, right? They just felt the heat. And so our sensory system doesn't always communicate very accurately with our cognitive systems to identify, right? But we're trying to rifle through and identify, based on our past experience, what does this mean and what do I need to do in this moment? So acute pain, again, isolated, brief, in the moment of injury typically. Chronic pain, however, is the result of our nervous system signaling pain long after, and they usually say about 6 months after the initial tissue damage has healed. And so chronic pain, the term chronic we're familiar with, right? It means long term, but it's tricky, right? Because it can be triggered by not just body sensations, but also by memories. And so going back to our experiences, if we have been in a motor vehicle accident, or if we have been in a bicycle accident or something, and we see this happen, we witness another one, we may experience sensations that mimic that, right? We may, because we've experienced that, right? When you're a parent and you have small children and they fall down and they scrape their knees, we go, oh, because we have mirror neurons that help us to kind of identify with that pain, but we have that experience to draw on, right? And so chronic pain can be tricky because it can be triggered not just by the physical sensations of going through our daily motions, but by our memories, our attitudes, our emotions around pain that we are experiencing. A neat book, and I'm going to start to kind of introduce you to it. This is a giant book. I don't love the way that it's put together. But Jon Kabat-Zinn, and we'll talk about mindfulness in just a moment, does a really beautiful job. It's his baby, this whole mindfulness dealing with chronic pain phenomenon. He goes through a lot of the distinction between acute and chronic pain in the very beginning chapters of this book. If you're able to kind of get your hands on it, you might even be able to do a little search for it online to see. But that's worth sort of making the distinction on, because a lot of the strategies that we do going forward sort of rest on that knowledge of what is acute versus what is chronic pain. When we talk about this mind-body connection, right? Of course we think, oh, of course our mind and our body are connected. But there are so many times when we are on what we might call autopilot. We are navigating through our world, maybe completely in our minds. We've all had the experience, I'm sure, where we've either been traveling by transit or in a cab, or even driving, where you've kind of arrived at your destination and you think, I don't know how I got here. Like, I don't even remember the route that I took, kind of thing. And that's a good example of being on autopilot. These are tasks that we might engage in, but our mind could be thinking about something completely different, right? If you're preparing dinner and it's a meal you've done a million times, you might not have to think about the steps that you're doing, right? Understanding the way that your body and your mind either communicate or don't communicate. For many of us, we don't often tune into what our bodies are telling us, right? We are used to kind of ignoring the signals, right? We're pretty good, sometimes not, but most of the time we're pretty good at reading our biological needs, right? I need to use the washroom. I need to get up and move. I need to, have a drink of water. I'm hungry. I'm tired. But think about how often even those really obvious signals get missed, right? If we're really focused on something, we can forget and suddenly realize, oh my goodness, my legs are asleep. I haven't moved in 3 hours. And so knowing your own tendencies in this regard is also useful, right? To think about, okay, how often do I actually check in with my body? if you're a client of mine, you're used to this. I do, one of the very first things that we work on together is the awareness of what's happening in this moment. What am I experiencing right now, right? Because we don't talk about it. We don't think about it enough. The second point here is being open to learning new things about yourself. In this book, it's called Full Catastrophe Living. The title is quite, I think it's quite clever, but it talks about wanting to not just be selective about our experiences in life. It talks about wanting to be open to the full catastrophe of life, not just the joys, not just the sorrows, the horrors, but everything. Bring it all, right? It's sort of saying, let me feel it, let me experience it, right? Because that is a life truly lived. We can't say, we can't pick and choose. That's not a life fully lived. So being open, in the book, he talks about beginner's mind. And this is experiencing things as if for the first time. And with our bodies, and especially with our physical sensations, we may be very quick to make a judgment about a sensation that we're feeling. Is it pleasurable? Is it unpleasurable? Is it positive? Is it negative? Is it pain? Is it pleasure? Looking at the different ways that we might categorize or label things, being open to the idea that there may still be things that we want to learn about ourselves forever, right? Till the end. So being open to learning is a kind of an important attitude, right, to have. And this last point here, again, with my clients, we talk about this a lot as well, of approaching things with a spirit of curiosity. In the mindfulness practice that we do, and certainly the link that is shared at the end is John Kabat-Zinn, who is the author of this book, doing a guided meditation. And he talks about just being aware, as opposed to saying, okay, this is a bad feeling. This is I shouldn't be feeling this, or I'm angry that I'm feeling this, and going into blaming thoughts. This isn't fair. Why is this happening to me? These kinds of thoughts. He says, to approach things with compassion and curiosity. And the word curiosity I use a lot because it has a slight positive quality to it, but it's probably more sort of neutral, right? When we're listening to our bodies, when we're tuning in, to be able to say, oh, I notice a sensation here. I feel, my palm has a little bit of moisture. No judgment, no thought, no really even reasoning why. It's just a comment, right? And noticing an observation. And we might do that with any number of sensations that we feel within our body, or sounds that we hear, right? Not working to label them, not working to, place them in any particular category. It's just being aware, right, of them in the moment. The diagram that's here in this is sort of the framework for cognitive and behavior therapy, which is often what is recommended when we're looking at dealing with mood disorders such as anxiety or depression, because we recognize the connection that our thoughts have with our behaviors, our actions, what we do. Meaning that if I'm thinking negative thoughts, I'm more likely to engage in behaviors. So if I'm thinking, oh, it's raining outside, I hate when it rains outside, and I have an emotion about that that's kind of negative, I'm like, oh, it makes me feel really sad and depressed and sleepy when when it's raining outside, my behavior may change as a result, right? I might stay inside, I might stay in bed a little longer. My physical reaction is then that my motivation might slow down, right? My internal systems might start to kind of slow down, and before you know it, I am feeling tired and I am not moving. And so the idea of cognitive behavior therapy is that little changes in any one of these areas can actually have sort of a compounding effect, right? It's not just, and you would know this, right? It's not just about positive thinking. It's not just about trying to affect your mood, right? You've all seen those things where you're saying, oh, bite on a pencil and you smile and suddenly you feel happy. Yes, but that's not going to fix the whole thing, right? But when we combine them together and say, okay, I'm going to look at going for a walk, even if it's raining. I'm going to look at trying to shift or spot some of the cognitive distortions that I might have about rain, right? I could start to shift them and say, well, the rain is good for the grass. It's important. It's spring. It always rains a lot. I don't know if you guys are in Toronto right now. The sun is shining. It's gorgeous. But these looking at little changes, right? Being able to maybe recognize the intensity of an emotion and saying, wow, that's a really strong feeling here. What can I do to shift that just a little bit? I know that I sometimes feel better when I watch a funny movie or when I talk to my friend or whatever it is, right? So we're making little adjustments in each of these areas with the idea that it has a more cumulative effect. Okay. So I'm going to guide you through a mindfulness practice now. It will be just short, but I want to have you be aware of just your surroundings in this present moment as it is right now. And I'm going to pack into this mindfulness, because it's guided, a little bit of the language that is used by Jon Kabat-Zinn. Okay, so in here, I'll share with you some of the principles that he talks about when he talks about non-judging, right? So that is when we're having sensations, when we're feeling these things in our bodies, not working to say, like I said, being critical of ourselves, kind of toning down that inner critic a little bit. Patience is the second one, which is being patient with ourselves, understanding that mindfulness is a practice. It is something that can sometimes actually be really unpleasant. And I think a lot of people have a false notion that mindfulness is maybe something that should come easily. You should feel super chill afterwards. You should feel, really relaxed and great and, connected with the universe. Mindfulness sometimes really is awful. Like if you sit down and you've got a really cluttered mind, the principles behind mindfulness say, wow, I'm going to be aware that today is a really crazy day. I have a million thoughts in my mind and it's just uncomfortable. And mindfulness says, I'm going to be aware of this because it's here already, right? I'm going to invite it. It's almost like putting out a welcome mat and saying, okay, you're here, you're welcome. All experiences are welcome, right? This is the idea of full catastrophe living. The other one is beginner's mind. We talked about that one already, of approaching things with a spirit of curiosity, right? Trust is trust in ourselves, trusting that what I am experiencing, what I am feeling is valid, right? Validating our own experience. A lot of times we look to other people, other things to validate our experience. If I am feeling sad, if I am feeling pain, I'm going to honor that experience in this moment. It doesn't mean I need to change it, shift it, grow it, shrink it. Doesn't mean I need to do anything with it because it's here already. All I want to do is accept it. Non-striving is another principle of mindfulness. And that is when you're in the act of mindfulness, you may find yourself saying, I'm going to try really hard this time. I'm going to try to really work hard at nailing this mindfulness thing. It's so, and that's striving, right? So the idea is that you're accepting whatever comes. Jon Kabat-Zinn says you don't have to like it, you just have to do it, right? And that means cultivating a practice day after day, whether it be pleasant or unpleasant, but doing it every day, right? His job is part of the stress reduction clinic at the University of Massachusetts Medical Center. And they did a lot of research in that center around pain management and attitudes towards pain. So they ran an 8-week mindfulness-based stress reduction course where they looked at symptoms, the number of symptoms that people experienced before entering the program and after leaving the program. And what they noticed was a 36% decrease in the symptoms. Didn't matter what the symptoms were, right? But there was a 37% decrease just by attending these mindfulness days. So there is a lot of evidence, and people are getting really savvy about doing research on it, right? So you won't have any trouble connecting with resources on this. And I'm sure it's come up in many of the other talks as part of this series. So you really can't escape it. I definitely have clients that resist it. It's something that, again, it's not necessarily something that people are comfortable with right away. I usually wait until we have a good therapeutic rapport. I also preface it with, you might feel a little funny doing this. You might feel a little uncomfortable, and that's okay, right? Honor that. Welcome that experience. I'm feeling embarrassed. I'm feeling silly. I'm feeling skeptical. Whatever it is, let it in, right? That's all part of it too. Okay, so we're going to just do a brief one here. I have my chimes. I like them because they signal the beginning and end. You don't have to have chimes, but there's tons of apps even that you can use. Jon Kabat-Zinn has a bunch of stuff recorded, either in podcasts, in like any sort of, I guess it's like YouTube videos. There's tons and tons and tons you'll find. And he has a lovely voice, I think. You have to find somebody that you really like their voice. So if you don't like mine, I apologize in advance. So we'll do a brief one here. So when the chime is completed is when the practice will start. So you have to see if you can listen all the way to the end. As you can see them. Okay. Wherever you are, see if you can arrive here in this moment. Whatever is happening for you, let it be. Let it in and welcome it. Almost like guests. You can become aware of the sensation of your feet on the floor, perhaps. The way your body rests on whatever surface you're sitting or laying on. Wherever your hands rest, become aware of the weight of your body as it connects to the earth. And as you become aware of this, see if you can tune your attention into the movement of your breath. This breath flows perfectly, adjusts without you even thinking about it. And as you attend to the breath, you might be aware of thoughts or images or urges, sensations that call your attention. You can notice those. That's awareness. And you're going to pull your attention back to your breath. Following each inhale all the way to the point where it turns to an exhale. And each exhale all the way to the point where it turns to an inhale. In this moment now, I'll ask you to put your attention on a place in your body that does not have any pain. See if you can locate a spot in your body that you can tune in to what's happening there. What sensations, if any, are you aware of? Maybe sensations of the air moving, sensations of temperature, tingling. Let your awareness really greet that place in your body. And now I'm going to invite you to turn your awareness ever so briefly to a place where you are experiencing pain. No need to dive into this. We can skirt the edges of that sensation. We can sit just outside the awareness of that sensation and become aware of the thoughts, the feelings, the beliefs and attitudes we might have about that pain. And instead of turning away from it, we're standing at the edge, observing with beginner's mind the sensations that are present, without judgment, with curiosity. And if you feel comfortable, on another time, you can take another step in towards that sensation to explore it. For now, I'll guide your attention back to your breath. Be aware of the sensations, thoughts, and beliefs that you have about that shift in awareness. Just aware, but gently, firmly bring your attention back to your breath. And in a moment, I'll signal the chimes. And when you're ready, you can open your eyes. Okay. When I do this practice with clients, I will do what I call an inquiry afterwards, which is to say, how was that experience for you? And in doing that, what I'm modeling is those same qualities of non-judgmental, right? They might say, I might ask, was it pleasant or unpleasant, right? You can describe pleasant, unpleasant. What parts of it did you notice, or what did you notice? What sensations did you become aware of? Can you describe that? What were the feelings that were connected to that for you? And again, it's that spirit of curiosity, right? I am now inquisitive. I want to know about that experience. And I have had clients say, that was terrible. I hated it. I had one client said she wanted to just jump out of her skin. I too have had that experience. I had like restless leg syndrome one time during mindfulness-based stress reduction classes, and it was horrendous. But even being able to sit with that horrendous feeling, right, and the judgments and the emotions that I had was an experience, right? When we become tuned into our experiences, we may become aware of thought patterns, of behaviors that may influence the way that we feel on a daily basis. When we are experiencing chronic pain, it's very possible that we become aware of heightened anxiety, of depressed mood, of beliefs that sort of perpetuate a feeling of hopelessness or despair or fear. And so what I've provided in the coming slides are just some guidelines that you can keep an eye out for. Anxiety in and of itself, for example, is a very useful thing, right? Just as pain is, it's an important communicator. Anxiety, if we had no anxiety whatsoever, we would never get out of bed in the morning. We wouldn't feel that little bit of butterflies that says, okay, I've got things to do today. I have to get going. It's motivation, right? Without anxiety, we wouldn't have that. But it obviously has an end continuum, right? That says, oh my goodness, the anxiety is so strong that it's impeding with my functioning, right? Or my low mood. We have days where our mood is lower, but if we're feeling this sort of ongoing hopelessness, we want to be aware of that. So I'm sharing this with you, maybe not just for yourselves, but for loved ones or people that you come into contact with, particularly during COVID. We want to be really aware of these. These are common anxiety and depression symptoms. I've been very clear here that it's not suitable for diagnostic purposes, but it might help to guide you in terms of knowing what might be within the normal range versus what might help, might guide you to seek professional advice, right? Your family doctor is a great starting point. They are very well versed. Anxiety and depression are two of the most common mood disorders that are out there. They're very, very well researched. The treatments are very well researched as well. And so you are not alone in experiencing these. And it's probably better to err on the side of caution when it comes to these things, to say, I'm not sure if what I'm experiencing might be considered, an anxiety disorder or clinical depression, as we might refer to it. But I want to make sure, I want to be diligent, right? Because a lot of times if you can catch things earlier, it's a little bit easier, right, to adapt the strategies. But unfortunately, sometimes we wait, right, until things get really, really bad before we seek help. There's still, unfortunately, a lot of stigma associated with particularly depression. I work with many, many people who will very visibly be suffering from depression, but will deny it, or have family members deny, right? Invalidating their experience by saying, you're not depressed. You just need to get up. You just need to think positively, right? Many of us, and I don't know the age group of the people attending tonight, but many of us grew up in families where these things were not discussed, right? There just wasn't the understanding of anxiety and depression. It was very much a shameful thing, or something that people were taught to just suck it up, right? So looking at these, I'm not going to read through them just in the interest of time, but if you have any of these symptoms or a handful of these symptoms and you're curious about, oh, does this mean that I might need some assistance with this? If you're finding that it's impeding on your functioning, if you're finding that the anxiety that you experience is creating interpersonal difficulties, anxiety unchecked oftentimes shows up as irritability, as does depression. But we may find that we are experiencing higher levels of conflict. We might find that we are unable to engage in things that we otherwise would have enjoyed, not because of lack of motivation, but because of fear, right? Of avoidance. Poor sleep is often connected with anxiety, both as a consequence of anxiety, right? We lie awake thinking about and worrying about things, but also if we are not rested, we are more vulnerable to anxiety and depression, right? So looking at these two lists of symptoms, it's there just as a guide, as I've mentioned. Prevalence of mood disorders, I stuck this in there just so if anybody ever has any doubt remaining about the just incredible common nature of mood disorders. This is Canadian data, which is rare. We often get data from the States, but to have a view here, you can see the pink is women and the blue is men. So women are almost twice as likely to experience a mood disorder than men, but the rates are very high in both male and female. And we can also see the age range, right? In the 35 to 64 age range, we see some really high numbers there, right? About nearing 10% of the population. Looking at risk and protective factors in your handouts, I do encourage you to take a look at these guidelines. You have some ideas there for protective factors. Risk factors for depression, we have a family history. If you have family members who you suspect as having depression, if you've experienced a recent loss, remembering that loss doesn't mean death. It can mean loss of a job, loss of a lifestyle, loss of a partner. If you've had previous depression, you are at increased risk for a second episode, and subsequent ones increase the risk thereafter, right? We've noted that women are 2 times more likely, and if you're in that age range between 20 and 40, but what we saw from that chart for the Canada numbers, it was between 34 and, or what was it, 35 and 64. It's not to say it doesn't happen outside of that, it's that this is an increased risk, clearly, right? The protective factors, look at these protective factors as it relates to the current situation with COVID-19. Social support, huge, number 1 protective factor. We see here a huge shift, right? We've seen a massive shift in the way we socialize, and a lot of people have struggled, right, with that feeling of purpose. Absolutely, right? These are protective factors, but on the flip side, if we're missing these protective factors, then we look at the risk factors, right? If I don't have a feeling of purpose, many of my clients are talking about that now. What does this mean? I don't have the same job that I used to have, or it's conducted in a way that is so different than what I'm used to. I'm having trouble connecting to a bigger feeling of purpose here. Self-esteem, coping skills, being able to access a variety of coping tools, our general physical health. If we are experiencing chronic illness or chronic pain, these things do affect our risk for depression, as well as our protective factors. And healthy thinking, right? If we're able to think, to address some of the cognitive distortions that we have, some of the maybe unhelpful beliefs or attitudes we might have towards pain, then that is a protective factor, right? Anxiety, we are very familiar. There's a handout as well on what is anxiety. We are all really familiar with it, but the continuity of it is what I want to draw your attention to here. So we start out with an anxiety trigger. Something, could be anything, right? Could be a visual stimuli. I'll give you an example from my own life. Terrified of balloons. I am absolutely petrified of balloons. I'm sure it came from somewhere in my childhood, but it's persisted. I have an anxiety trigger. I now, in response to that, human response to anxiety trigger is to avoid the trigger. I will go out of my way to avoid balloons. On a subway, I'll get off the subway, get onto the next car. I will, walk out of a store if they're inflating balloons. I avoid, children's birthday parties as much as I possibly can. My own children have never had balloons. It's quite funny, I guess. But the problem is that that has reduced my anxiety by avoiding it, right? But what it means is that I'm never addressing that anxiety, right? I'm never really looking at ways of reducing it. So the anxiety grows, and that's the truth of everything. Anxiety wants you to avoid it, to avoid the trigger, right? It says, oh, that's dangerous, right? It's an alarm system. That's dangerous. Avoid it, right? Thinking about it in the context of pain, I'm feeling pain. Oh my gosh, I must be doing something wrong. I'm feeling pain. I must avoid whatever it is that I'm doing because of my beliefs about pain causing damage. I may avoid something, right? When really what I need to do is look at ways of being able to manage my anxiety in the moment, but also to adjust some of those beliefs about the pain, right? And that's the mindfulness component. We're aware of coping strategies. It's funny, in the presentation, I actually had mixed up the headings, and Ellie very kindly was able to spot it. But we're aware, we need to be aware of our own unhealthy coping. We've all got our vices. We've all got the ways that we might cope with anxiety, and avoiding is often a big one, right? Looking at ways that we might adapt or adopt healthier coping strategies. We are, again, well versed in these. The truth of the matter is that mental health, like physical health, does take discipline. if we are prone to anxiety and depression, if we have a family history, if we are already experiencing mild symptoms, it's a very similar thing to someone who's very susceptible to a cold or perhaps has seasonal allergies, in that we know this. And so we have certain areas where we might need to be a little bit more disciplined, right? Maybe during hay fever season, we don't go to the country. And so we make adjustments, but we might say, okay, during that season, I take an antihistamine. We might need to look at ways of managing the anxiety and depression in the moment. With grounding techniques and relaxation techniques, these can be very useful when it comes to acute experiences of pain or panic, anxiety. Anytime that we're starting to experience what I call kind of getting locked in, right? It's like we go in, you talk about that fight, flight, or freeze response. We may very well have kind of gotten stuck in a loop, right? And we're all aware of those times when we feel flooded, right, with emotion, or perhaps stuck in a particular train of thought or in a traumatic experience, right? That's a very common one, in fact, for trauma. And our system becomes quite dysregulated. And a way that we can bring ourselves back into the present is by using what's called a grounding technique. I've given you some ideas here. One of the favorite ones that I like to use with my clients is either tactile. So it's basically really engaging yourself in the present moment, in the reality of the present moment. So for my clients, I'll often use something tactile. I might say, grab, your glasses and become really fully aware of the sensations that you're feeling. You might close your eyes or open them if that helps, right? To bring your awareness to the physical surroundings. Perhaps it's colors. I'll say, let's see if we can find everything that is, sky blue in this room. And they might go through. And then when you think you're done, find 3 more. This is a way of really pulling us out of the panic or anxiety, distress that might be happening in our minds, and grounding us in the present moment. Very effective techniques and worth sort of exploring. So you've got a few of them that you can pull out when you need to. Relaxation techniques as well. I've provided a list there, and I'll let you guys go through that stuff afterwards and explore what works for you, right? This last little section I'm going to spend just a moment on, but this comes in with our belief system. Every one of us, locus of control sounds very scientific. It's really not, and I don't want you to get tripped up with the lingo of it, but I want you to look at the drawings here and the red and the green square. So there's what we call an internal locus of control and an external locus of control. We can switch back and forth between these, but by and large, we have kind of got tendencies, much like our cognitive distortions are tendencies. When we're under stress, we may exhibit an internal locus of control, right? Which means I am empowered. I make things happen. I am in control. I believe this. Conversely, we could, under stress, feel that things happen to us. I see the control as out there. I am being controlled. There's no point. Why bother? Why try, right? So you can see one of them has the person as being in control, right? I am internally in control of what's happening, or things around me are in control. When we believe that things are outside of our locus of control, we start to feel helpless. We can engage in unhelpful thinking patterns, which influences our behavior, right? And so we start to believe that we cannot have effect. These are things to be aware of, and again, things you can talk about with your psychotherapist to say, how do I identify what my locus of control is, and what are things that I can do to effect change? With my clients, I will often do these little check-ins that say, what is happening for me in this moment? We talked about it earlier. And what do I need? There's 2 questions. What's happening for me right now? Could be a body scan. I'm hungry. Oh, my leg's going to sleep. What do I need? I need a snack. I need a drink of water. I need to uncross my legs so the blood starts flowing. And so by doing that, they start to learn that they, one, can validate their own experience, but two, they shift their locus of control to more inside rather than outside, right? I'm feeling thirsty. Oh, it's because so-and-so left the temperature up and it's so hot in here and the air is dry. External locus of control. Internal locus of control, I can open the window myself. I can get myself a drink of water. I can take a break if I need to, right? Okay. We talked about this in my first webinar as well, this balancing of acceptance and change. We tend to we tend to be very black and white thinkers as humans. And so thinking about, over what do I have control? Over what do I not have control and therefore must accept? Accepting something doesn't necessarily give it permission to continue forever. What it does is say, I acknowledge that this is my present circumstance. I am fully aware of what's happening here. I may be in this process working towards a healthier routine. I may be working on following my physio techniques. I might be visiting with my psychotherapist to learn new ways of thinking. I am willing to change. However, I'm accepting myself in this moment, full catastrophe, right? So I'll leave it there. There is a handout as well on self-care tips. I guess we'll turn it over to Ellie and see if we have some questions. I've got a couple of resources here at the end as well. I'll leave that with you. Here is the list of the upcoming webinars. Definitely worth checking out. I'm going to check them out as well, more in the recording phase, I think. And so we're just wanting to remind you that we're here. We are offering our services online. We do that globally. We offer in-home visits in Ontario and in Alberta, but wanting to make sure that we're here, and we want you to know that you're not alone. We are in this together, and anything we can do to help. Okay.
So there's no questions. I think you covered everything. I don't think anybody has. Well, there are no questions. You did a great job. Cheryl, really great feedback on walking through the mindfulness exercise. Just fantastic stuff all the way through. Always informative and practical and to the point. Just great techniques that you have. I'm getting thank yous. And a wonderful job as always, because people tuned into your first one as well. So chat, I'm interested if you'd like a free consultation or if you want to book Cheryl, but please tune in. We have 4 more weeks to go. And great topics coming, great therapists. And I'm so proud of all of you, but Cheryl, just fantastic job once again. The amazing Cheryl. So we'll do virtual claps. And we'll say goodnight, and we'll see you all next week. And if you miss anything, definitely just let us know. But there's always recordings that are going to be available. Yes, I'm getting thumbs up and claps, virtual claps with hearts, I think. Wow, amazing. All right, Carol, have a great night.
Have a good night, guys.
All right, take care. Bye, everyone.